Hi, this is Dr. Van Reken at Reno Sparks MedSpa in Reno, Nevada, and I've had the good fortune to have Molly working for me for almost 3 years as an esthetician and also back office and laser tech. And today she'd like to get a mole reduced a little bit. And one of the things about moles is you've got to see if there's pigment or not, if there's any chance that it might be a skin cancer, things like that. So it's good to have a practiced eye. And if we look over here, I'll put my glasses on for this, why not? She's got this little mole, it's well under 1 millimeter. It is monocolored, by which I mean it's about the same color as the surrounding skin. So when you take this off, they tend to look pretty good. If moles are pigmented, sometimes the pigment goes deep, a little bit more complicated. Even if you get them flat, you might have a brown spot. So that's not something we have to deal with today. So we're basically going to take a round loop, put an antenna behind her head, numb her up, and then we're going to go bzz, 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 and we're just going to destroy this. Think of it as a hot wire through butter. And if you had a cold stick of butter out of the fridge and you just kind of went like this, you could shape it. That's what we're doing. We're going to shape her face. And when we're done, there will be no stitches. It'll be pretty flat, and then it'll heal over with skin. It may look a little bit yellowish or whitish, sort of fibrous looking for 3 weeks, 4 weeks, maybe even 6. Should look pretty good after that. A lot of people can't tell where it was done a month or 2 later, but that varies from person to person. Okay, so this is Dr. Van Reken. This is a little wire loop. It's less than 1 centimeter. You can see this loop is about the size of the mole there. This is a wet procedure. We're not actually producing heat, although there will be heat inside the cells. It's a wet procedure because we're heating up the water inside the cells. So if we keep it wet with something like a little lidocaine like this, it works better, it cuts better, and you get it's a little easier and quicker to do. Thank you, Lily. And so when I step on this, you'll hear a sound. That means the juice is on. You ready, Molly?
Yes.
Okay. Tell me if you hurt. We've already numbed her up. You can see it's a little whitish there from the adrenaline and the lidocaine, so that's what the color change is. And we'll see if we can get this a little thinner. And often we use a smoke evacuator, but it's in another room right now being used. So I'm going to give Molly a mirror and see what she thinks, and see if you like the look. You can see that it's a little irritated where I did this. But it's less raised. Take a look there. What do you think so far? I'm thinking maybe a little bit more off there.
I think so too.
Okay. But I think it's important to collaborate with the patient, whether you're doing fillers or Botox or lasers, and kind of ask them what they want, because what they want, what the doctor thinks would look nice, aren't always identical. And in the final analysis, you'd like to make the client happy. And I am pretty happy. So let's do a close-up of that. And you'll see what I said about it looking a little bit yellow and fibrous. It already does. And that will change as the skin heals over. All right, you want to take one more look with the mirror, Molly?
Sure. Oh, wow.
You like it?
Yes, thank you.
All right, you're welcome. You've worked here almost 3 years, and you've seen me take off a number of these moles using this radiofrequency machine called the Ellman Surgitron, but this is the first time you've had it done, right?
Correct.
Did it hurt?
No.
No? Just numbing it up a little bit, huh?
Just the initial numbing, and then I could feel you scraping across my skin, but it didn't hurt. I just felt the pressure of it.
Okay, you like the way it looks so far?
Mm-hmm. Thank you.
Okay. All right. This is Dr. Van Reken signing off for Reno Sparks MedSpa. Make sure anybody that messes with a mole knows how to look at it, make sure it's not cancer, doesn't need a biopsy, something like that. That's always important.